On the day we hit yet another milestone that seemed unthinkable 10 months ago, 300,000 people killed by COVID-19. Nearly 3 million doses of Pfizer's vaccine are now in the hands of hospitals and other facilities across the country, or soon will be, including here in Massachusetts. This morning, we got to see the first frontline workers getting their shots after the FDA officially signed off on emergency use authorization on Friday. Certainly reason for celebration, with many noting they were surprised at how emotional they got watching those first vaccination scenes. Now, if Moderna's product is also granted emergency approval in the coming days, as it's expected to be, federal officials say they'll be able to distribute 100 million doses of vaccine by the end of February, meaning as many as 50 million people could be fully inoculated with 2 doses each. But in a nation which has a population north of 330 million, the vaccine is unlikely to significantly slow infection rates until it becomes available to the general public, which isn't expected until maybe the end of June. So this is just the very beginning of a still long and winding road to the end of the pandemic, as top experts keep warning.
Now's not the time to get infected. Please take care of yourself, do the public health measures, keep distance, wear masks. You don't want to be somebody who gets infected because you get careless when help is near and the end is in sight.
Here in Massachusetts, our trends indicate we need to heed that warning as much as anyone, and fast. To that end, Boston Mayor Marty Walsh announced this afternoon that he and the leaders of several surrounding communities are tightening restrictions for at least the next 3 weeks starting Wednesday, tighter than Governor Charlie Baker is doing statewide. Boston, Newton, Somerville, Brockton, and a handful of others are capping indoor gatherings at 10 people and outdoor gatherings at 25. And gyms, museums, movie theaters, and certain other businesses will have to close. Joined now by Sam Scarpino. He's director of Northeastern's Emergent Epidemics lab. Good to see you, Sam. Thanks so much for being here.
Thanks for having me.
I read your comments in Shirley Leung's piece in the Globe yesterday. What are the trends? What are the numbers that have you most concerned?
The trends that have me most concerned are the rising percent of positive individuals over the past couple of months, the rising hospitalizations that go along with that. It's the fact that we've seen this week on week on week continuing to go up that is most worrying.
My understanding is the positivity you're concerned about is not overall, but first-time tested people. Why do they matter more than others? Why is that number so significant?
That's right. It's admittedly a bit of a mouthful, but I think if what we're concerned about is the chance that we run into somebody with COVID in a restaurant, for example, then we care about the statewide positivity rate, which is lower than this percent of first-time tested who are positive. However, that second percentage is the one that correlates much more strongly with hospitalization demand, and that's our biggest concern right now, that the hospitals are going to be overwhelmed. So we're very closely watching this second number, the percent of individuals who are tested positive, and it's their first COVID test.
You know, the other number that stands out to me, and I obviously don't do what you do, is the daily case rates appear to me, correct me if I'm wrong, to be almost double what they were during the spring surge. If I'm right, how concerning is that?
That is very concerning. We are seeing much higher daily case rates than in the spring. Now, there are 2 caveats to that. Our detection systems and our testing are much, much better. So we are ascertaining a lot more cases now in terms of percentage than we were in the spring. In addition, we are doing a much better job of protecting individuals in that highest risk group, and that translates into a lower hospitalization rate. So we are actually seeing a lower percentage of individuals hospitalized, which of course is a very good thing.
Yeah, but wasn't it Ashish Jha who wrote in the Washington Post, the lower hospitalization numbers are troubling to him? And he says, I believe what his argument was, it's because there's so many younger people who don't get quite as sick as others, but can be spreaders, correct?
No, from the perspective of the actual spread of the disease, it is a very big challenge and likely contributes to the continued increase in cases because you have individuals that are out going around potentially infecting other individuals. From the perspective of actual hospitalizations, it perhaps is a bit of a silver lining, but you're right that from the overall epidemic perspective, it's very problematic.
So if the positivity numbers, as you look at them, the ones that are most concerning, these first-time test takers, positivity numbers, correlate more directly to hospitalizations. Translate that for me. What does that mean if that trend continues? Apparently our hospitalization capacity is in better shape than some other states, but what's the danger you see a couple of weeks or whenever down the line?
We are doing better than other states, which is a good thing, but the danger is that individuals who are testing positive today by this measure, they're already sick and they are essentially already going to have to be hospitalized. It just takes time for the disease to progress. So the projections are that by Christmas, we may see a 30, even 50 or more % increase in the total number of individuals that are in the hospital. And that puts us very near the red line for hospital demand.
So the obvious question is what to do in response. And I have to say, well, I commend, because they're tough decisions, people like Boston's mayor and the other communities doing this, what they announced this afternoon. But I say to myself, well, if you can't go to a gym in Boston or Somerville, you go to a gym in a neighboring community. If you can't go to a movie theater in one of those, you go to another. Am I wrong about that? It seems to me well-intended, but limited effect.
I think you're right. One of the biggest challenges we face both in the state and nationally in the United States is we need a coordinated response for two reasons. One, we need federal dollars in order to provide financial support for sectors that are being hardest hit, like the restaurants and the gyms. But as you pointed out, and there's very good data to show this, work we've done at Northeastern in collaboration with an international consortium shows that if the gyms are closed in Boston and they're open in neighboring communities, that people will go to the neighboring communities to go to the gym. So we need a coordinated plan to bring this under control.
So you're quoted in yesterday's Globe story as saying the real concern is there might not be any options left except for a lockdown. Expand on that a little bit, if you will, Sam.
Many of us have been advocating for going on months now that we needed to take the kinds of measures we're finally seeing weeks and weeks ago so that we wouldn't have to go into a lockdown. As I mentioned, individuals that are going to be hospitalized in 2 weeks are already sick. So anything we do today is only going to really have an effect 1, 2, 3 weeks from now. And so if we continue to wait, we may find ourselves in a situation where there is no other option besides a lockdown, which is something that we have been trying to avoid.
So what should we be doing statewide?
Well, statewide, we should be providing financial resources to individuals in the restaurant sector so that we can strongly limit indoor dining. It's something that the CDC has consistently shown to be amongst the highest risk factor because we have masks off. I think the limits we've seen on indoor gatherings in the greater Boston area and Somerville are critical. We need to see those kinds of things statewide. And we need a coordinated plan for test, trace, isolate that we're going to layer in with the vaccines as they become available so that we can get to a new normal much faster than June, July, August. I think if we're still in this situation next year, it's going to be totally unacceptable. And because we didn't have plans, coordinated plans in place now to best leverage the vaccines.
So I want to return to something you said a minute ago. Assuming there are only modest additional changes made on restrictions, the governor moved back from phase 3, part 2, or whatever it's called, to 1. Obviously, some of these mayors went back a little bit farther than that. What do we look like come January 1st if there are not drastic changes in those criteria?
Well, if we continue to see the kind of week-on-week increase in the positivity numbers, all positivity measures in hospitalizations, in ICUs, things are going to get increasingly dire. And as we saw in the spring, this is not a linear disease where it gets a little bit worse. This is an exponential disease where it gets worse fast and then becomes completely out of hand. And so the risk is if we do nothing, we get a surge over the holidays that are coming up as a result of gatherings, that we are going to be in a terrible situation when it comes to deploying the second tranche of vaccines.
So your point is the time to act is now. Is that correct?
I think the time to act was a month ago, but if we don't act now, we are going to be in a nearly untenable situation come January.
Sam Scarpino, thanks so much for your research and thanks for your time. I appreciate it.
Thanks for having me.